There are really two primary things that we have to take into consideration when we talk about healthcare and how to get the cost of healthcare down. The first is the incredible complexity of the system that's caused by having a third party payer. This is not a direct to consumer product. You pay an insurance company, and that insurance company pays for your healthcare. The end consumer is not paying for the healthcare. So there's a ton of complexity in terms of, instead of making this a direct to consumer product where here's what these things cost and you pay me and I give you this service, there's this extra step involved in third party payer administration, which does not get eliminated, maybe simplified. You could say it might get simplified with government intervention, but it won't, because we'll have 50 states doing things somewhat differently. But you could say it might get simplified by a universal system. The second thing we don't talk about is the moral hazard of a third-party payer, where neither the consumer of the product nor the producer of the product has to be concerned with pricing at all, because the consumer is not actually paying for the product, and the producer of the product doesn't have to sell the value to the consumer, because the consumer is going to hold their third-party payer responsible for saying, this is too expensive, or we're not paying for this. They're automatically going to be the bad guy. So you have a system where there is a ton of unnecessary complexity combined with the moral hazard of neither the producer or the consumer having to be concerned with pricing. And that is largely what causes, if you take all the other issues, all the other regulatory environment of our healthcare system, right, in a nutshell, those two issues are the predominant cause of skyrocketing healthcare costs in this country. And you solve those problems by doing everything you possibly can to get healthcare back to being a direct-to-consumer product. Every single dollar that anyone pays for healthcare, every single dollar that anyone pays for healthcare should be 100% tax deductible. For starters. Second, there should be 50 state regulatory reciprocity for health insurance companies and healthcare providers. What I mean by that is, if you are a healthcare provider in the state of Minnesota, in the state of California, in the state of Texas, in the state of South Carolina, and you pass that state's regulatory requirements in order to provide that service within the state, right? Then you should be able to engage in business. You got to, hold on, let me slow down a second. You have to meet that state's regulatory environment as well as federal requirements, right? Which kind of stinks. The federal government really shouldn't be involved in this at all, but that's a whole nother conversation. You meet the federal government's regulatory requirements as well as the state in which your headquarters is domiciled, and you can now engage in business in all 50 states. I don't have to go into South Carolina and meet their regulatory restrictions as well as the federal government's. And then if I want to do business across the border into North Carolina or into Georgia or into Tennessee, I've got to meet their regulatory requirements. I meet the federal guidelines, I meet the state guidelines. I can engage in healthcare services anywhere in the country. And the same should apply to health insurance companies. Cross-border competition, right? Not free from government regulation, but certainly greatly reduced and less complex. Okay. Those two things, maximizing competition by creating an environment where cross-state sales are allowed or easier or less regulated, and then making it so that it's far easier for consumers to understand and have some skin in the game when it comes to what it actually costs to get healthcare services, would do far more to reduce the cost of healthcare in the United States than would a, quote, universal system in which you're going to have the federal government doing one thing and all 50 states having different regulatory requirements for the providers and insurers within their state. It doesn't make things less complex, just makes things less efficient. Those are the two things that I think we need to do to fix healthcare.